Speaking of Hope, Support, Heal, Season 2.
Hello and welcome to Speaking Of, a podcast brought to you by Axios International, and I'm your host, Sudashini Christopher. Speaking Of podcast gives individuals a platform to share their insights, perspectives, and stories of encouragement with those facing similar struggles in their journey toward hope, support, and healing. In Season 1, we listen to the voices of those whose stories often go unheard. Season 2 promises to be different and even more impactful, featuring stories of resilience and initiatives addressing healthcare access challenges, not only from patients but also from key thought leaders and change makers. These individuals play important and unique roles in making access to care and treatment a reality for many. Most importantly, the common thread connecting us all is that we share stories of hope, support, and healing in one way or another. And in this episode, we are honored and delighted to introduce our first inaugural key opinion leader who has been instrumental in giving voice and support to many individuals in need of care and treatment at various stages of their life journeys. Today we have with us Dr. Hussain Jafri, the Executive Director of the World Patient Alliance. He is also the Secretary General of Alzheimer's Pakistan, the National Association of Alzheimer's Disease and Related Dementias that Hussain founded in 1999 as a result of his experiences as a caregiver for his grandfather with Alzheimer's disease. He has been very active in the field of patient safety and has remained the Vice Chair of the advisory group of WHO's Patients for Patient Safety program. He has also founded the Pakistan Patient Safety Initiative and has been working on several key projects. Dr. Jafri is deeply involved in the field of patient safety and is a passionate speaker and thought leader, speaking of issues like patient-centered healthcare, caregiving, advocacy, partnership in health and organizational development. Today we are delighted to have him here to share his story with us. Hello, Dr. Jafri. How are you?
Hello, thank you for having me here.
We've seen you speak in many forums, but to have you personally for podcast is actually a great pleasure. So tell us a bit more about your journey and how you came to be involved in the healthcare field.
Yeah, so my journey into the healthcare came by accident, total accident, and it was a personal story, my family story. Actually, what happened was when I was very young, in my late teens or so, my grandfather started behaving very oddly, and we weren't sure what was happening. He had retired a few years earlier, and then he would meet people, and then he said, "I've not met anybody." He would eat food. He said, "I've not eaten food." He has gone somewhere. He said, "I've not gone anywhere." So we initially thought that he was joking or something, and we all laughed it out. But after some time, we realized that it was something happening with him, and it was not his normal self. So my father asked me to take him to a doctor, and I took him to a GP in my neighborhood, and the GP said he's all fine. So I told my family there's nothing wrong with him. But then his issues started to grow more, and he was more forgetful, and he started scribbling on walls and people's names and telephone numbers and stuff like that. So he was literally destroying the walls of the house, his cupboard, and everywhere. And then gradually my father again sent me to a doctor. So I took him to a specialist. Again, the specialist said there was nothing wrong with him, but the problems grew, and then it came to a point then when we started having problems in our family, and he would ask for food again and again. If my mother would give him food, his tummy would go loose. He would dirty his clothes, and those things started happening. And then he would argue with my mother that why don't you give me foods, that sort of a stuff. So my family thought that it was an intentional effort by him because he has retired and it was an attention-seeking behavior. There's nothing else that he can do, so he's just seeking attention. So my family, they started rationing his food and keeping him away from the guests and everybody else. Well, So my grandfather, over a period of about nearly a year and a half or 2 years, a man of 85 kgs was reduced to about 55 kgs because
Mhm.
of the rationing of food and everything. And it was by luck, a chance, I met a doctor who was very old. I remember he was 85 years old and a normal GP. And
Mhm.
he said, "Oh, this is Alzheimer's." And I
Mhm.
was so relieved and relaxed. And I thought, my God, there's somebody who knows what it is.
Mhm.
And I said, "Well, good. Please give him the medicine." He said, "There's no medicine. We can't do anything about him. He'll be bedridden and gone in about 4 or 5 years." So
Mhm.
that was a big blow for somebody who's been raised by your grandparents.
Mhm.
So I came back. I told my father that, this is what the doctor said, that this is Alzheimer's, but there's no medicine. So my father thought that, being very close to my grandfather, I made up a story and came up with the name of a disease, which is actually not there, because he said
Mhm.
there's no disease for which you don't have medicines.
Mhm.
So our problems, kept on, the problem was still there. Then I went to England after some time for my training in genetics. And
Mhm.
this is where, I saw, while walking on on the road, I saw a board, Alzheimer's Society UK. So I
Mhm.
thought, oh my God, this name still, it
Mhm.
exists. So I went inside, and they gave me 5, 6 sheets of paper that I brought back to my country, Pakistan. And then I shared it with
Mhm.
my family. And that was the first time ever that they realized that there was something actually wrong with him. And so everything changed within my family. My
Mhm.
mother, my sister, everybody, took charge, and they made sure that my grandfather was looked after properly. and
Mhm.
and 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 that time I realized that it was just the issue of just 5, 6 pieces of paper, and that's all. So my grandfather's life was totally changed. So
Mhm.
I thought that, I have gone through this. My grandfather's gone through this. My family has gone through this. I knew to do something about it. So
Mhm.
that actually led me to establish Alzheimer's Pakistan. I thought that, I must do this for others. And I just realized, if this is happening to somebody who lives in a big city,
Mhm.
a resourceful family, an educated family, so what's happening with others?
Mhm.
Who are less fortunate, less educated, or live in far-flung areas. So
Mhm.
we established Alzheimer's Pakistan, and that was that's how I got,
Okay.
embarked on this journey.
So I think, like, as a person, a key person in your life, and you were his grandson, and then this whole experience has had an impact in your life. But you didn't leave it at that. You were curious. You always had it in your mind. You wanted to find answers and solutions and stuff like that. And then you have been the change agent, even for your family, because you said, like, even the perception of your mom was like, okay, this could be a intentional seeking behavior, but you didn't stop there. It was new to you as well as a grandchild, but you kind of like took it on you to seek answers, right? So how do you see, I know you said it's less fortunate for some people, so we have to pave the way for them, but how do you see these challenges playing a role, um, even for you as a being a change agent, and to where you are, you've become, right? So what are the key challenges, and how does it play a role in influencing or impacting people's life?
I think it depends upon the society, about the country where you are, and every country is at a different level of development in terms of healthcare as well. So, coming back from a country from subcontinent, I think
Mhm.
um, I'm talking about the time when the internet had not come in, so
Mm.
that source of information wasn't there.
Mm.
But I feel that the challenges are there for families. We're talking about, they don't understand, that there's something wrong with the person. The healthcare providers are unable to make a diagnosis.
Mhm.
Therefore, they cannot inform, provide any information. They are unable to treat such people. And similarly, our policymakers don't understand, that this is an issue and for which something needs to be done. There are no services available for many diseases in many countries. There is stigma associated with many of these diseases, especially with the diseases that have, psychological issues attached to them. So there's a lot of issues, but it depends upon, from where you are coming. But this is what I faced as far as, my own journey is concerned. And there's a lot of stigma associated with diseases as well, and people don't understand that this is a disease, and how do we need to really look after people, what are the services that need to be developed in the country, and how to really, and it's not only, I must tell you, it's not only the patient, sometimes who's affected, it's the caregiver. So I myself, I really went through a very hard path, because I couldn't find anything for him. I myself was having issues with why is he doing it, and then keep hiding him from other family members, and the stigma associated with it. So there are a lot of many challenges. And then access to healthcare, I've already talked about. I think there's so many challenges that patients and caregivers face all over the world.
You said these challenges did remain at the time where internet was not there, less awareness, and so on and so forth. Do you see it is still relevant in today's digital age?
Oh yeah, it's still very relevant. So since I talked about Alzheimer's and dementia, let me tell you, I think there's a very small percentage of people who are still even diagnosed. If I remember the stats correctly, I think it's just about 10 to 20% of the patients who get a diagnosis. Even in the most developed countries, I think the rate is getting better. But if you look at the global situation, it's still the case. There's still people are unable to diagnose dementia. Therefore, the sort of services and the care that is required by the patient and the families, that's still missing.
So what shaped your approach to overcoming these challenges, especially in your journey, in your personal journey to patient care, advocacy, and you're very keen on talking about patient safety? So what exactly was the point that shaped you?
As far as my personal story is concerned, was that piece of information that was missing, and that was the total game changer for our family. So I realized that I am in a privileged position, although I was very young, but I thought I'm in a privileged position. I need to do something for others, and that was, I think what actually led me to start this. I talked to other people, I talked to doctors, I talked to other, so I managed to gather a team around me. And I think it's also a very important message that I want to give in this podcast is that, people should not try to work alone. It is very important that you make partnerships, you make collaborations, you make teams, so that when all of you are together, you become a big force and a big voice, and you can really carry forward your message to masses rather than just one person trying to do it alone. And that's what I did in my case.
Okay, so would you say today, with all these initiatives that you've moved the needle with the support of the teams and the wider groups, and like how much of influence and impact they had on you and you had on them? Like, how was it, the journey?
Yeah, I think it's as a personal story always has a very strong impact on others. Patient stories tell you so much. You can go through a whole book, but you won't understand what people go through. It's a personal story that really makes it relevant to people. So my personal story was the beginning point, and then I remember I went to the president of the Pakistan Medical Association. So I happened to know her, and she heard me and she said, "Oh wow, you are right. This is something we really need to work around." So she said, "I'm on board." So with her coming in, I had the access to the medical fraternity. Then I talked to lawyers, and I talked to there are so many people. So I think they all joined hands. Once you see that it's a cause that really needs attention, people do join you. So I think it's not, people should not feel afraid that, who will listen to me and they will not understand what I'm going through. People do understand. I think it's just your issue that you need to convey the message and tell them, all right, so say they heard you, they understand what's the problem, but that you also need to tell them, what are the solutions, what needs to be done, and this is where, all of this team then start working with you, and that certainly really brings about a lot of change.
Yes, very true, very true. It's all about taking that first step. And then that's what you did. And now you fast forward, there's been many things, many impactful projects that you've led. The other issues, like, for example, the gender, socio-economic status, and also the geographical location, which we talked about, even that plays a part in people having reach to a piece of information and whatnot. How do these factors impact a person's ability to access care and treatment?
Well, I think I must say that they really greatly impact healthcare access due to social norms and discrimination. So, for example, if in some cultures, women need permission from male family members to seek medical care. So gender actually plays a lot of role. And if you know that the maternal mortality in many parts of the world is very high, and the reason for that is that they don't get that sort of permission from their male family members to go far off places to seek medical help. So the maternal mortality is very high, and one of the factors is the transportation or access to healthcare. So gender, as you said, is a big issue. Socioeconomic status, is also a major determinant of healthcare access. People with lower income often struggles to afford healthcare services, insurance, and even the cost of traveling to a medical facility. So, for example, a single parent working on a minimum wage job may not be able to afford necessary medication for their child, or might skip medical appointments due to the inavailability to take time off work. So in many developing countries, the lack of financial resources mean that even the basic healthcare services are out of the reach of a large portion of the population. That actually leads to preventable illnesses and even deaths. And then geographical location, I think I already touched upon that, but geographical location also play a very crucial role in healthcare access. People living in remote areas often have very limited access to healthcare facilities, and they face long travel distances to reach clinics or hospitals. So even in the most developed countries, like in America, I must tell you, these disparities exist, So your postcode actually determines the sort of services you will receive. Even in America, in England, if you live in a good neighborhood, you will have access to good health facilities. But if you don't live in a good neighborhood, your health facility services that are provided to you are not good. So it's not, in many cases, just not issue of developing countries, but I think it's across, all over the world. The people are facing similar issues.
So do you think equity or bringing equitable solution plays a part? Like, you brought in these examples of developed countries, big countries are often seen like okay, they are well taken care of, but you are saying no, there are still realities with unmet needs. Likewise, even in other countries, you would still think a rich population would have help, but according to the examples that you brought forward, no, they still do have unmet needs. So how do you think an equity or bringing an equitable care plays a part? And have you done any projects specific to this nature?
Yeah, I think equity, as I said, it's very important. Otherwise, one portion of the population will get services, the other one will not have this sort of similar access to it. And I think there's an advantage with the technology coming in. I think there are more and more chances of people getting access even in the most remote of the areas. So I feel that these telemedicine or these health apps and the artificial intelligence that's coming in, the mobile health clinics, uh, all of these things are really bridging that gap between access and people are. I think in even in most developing countries, people even now have access to this mobile, and they can really access the whole world. So I think things are changing, and I think this is exactly what my experience has been. We are also now relying more and more on these gadgets and these technologies to get access and convey our messages to these communities, and they're also using these technologies very well.
I know from a healthcare provider perspective, of course, you are very much involved, and you also have a caregiver perspective in your personal journey, and you deal with a lot of people who need help when it comes to the disease areas and whatnot. So how do you see them receiving this support or receiving the technology as a complementary or an enabler for them to access healthcare?
Yeah, I think these innovations are certainly making a difference. I won't say that everybody is now good and they have got everything in there. That's not the case. But I think this is a good beginning. People's, especially all of the world faced the same issue during COVID. Just imagine, so you were like, sitting on moon or somewhere, just isolated and with no access to healthcare and these telemedicine and all of these technologies actually made a lot of difference. As far as the poorest of the poor, who don't have the access, I think mobile has made a lot of difference, but there's still a lot needs to be done for those populations. And this is where, we at World Patient Alliance, are working through a member organization from all over the world, and, working on, especially on advocacy for access to healthcare. People do, at times they do, most of the times they don't have, as I mentioned earlier on as well, finances to even, go to a health facility or to buy some medicines. So we are coming up with innovative ideas, how to, come about that. But then there are companies like, I know Axios is also one of it, that has these innovative solutions, providing people assistance with medicines, very life-saving medicines, so that those sort of initiatives are, I think, very important.
And you talked about the technology also, like whether it's AI or smart devices or just a mobile phone playing a role in improving healthcare access. Are there anything that you personally feel, in your opinion, this could have been done better, this could be changed?
Well, I personally feel, I think they are very good, and just understanding the evolution process. These technologies have just really now started, so you can't really complain that that they are not really fulfilling all the sort of requirements that there are. So I think, and my understanding is that I think with the AI coming in, I think there's going to be a lot of change and very fast as well. So I don't feel, I think they all of them have some limitations. But I think this is an evolution process, and I think this is something that we learn from and develop our services accordingly. You need to understand that the health force in the world, it's a very small health force, and the population and the patients with the chronic conditions, millions and millions and over a billion of people, suffering from chronic diseases. This current health force cannot cope up with these numbers. So we have to come up with these innovative solutions for the population to get access to healthcare. And I personally feel, I think all of them are really making a lot of progress. There's still a lot more needs to be done, but I think it's a very good beginning.
Yeah. Is there any particular one story that you can recall that has deeply rooted in you, in your heart and mind, and also serves as the best example of receiving access to healthcare or overcoming a specific barrier to access to healthcare? Any particular story?
Yeah. Well, I think there's so many stories, but yeah, some are stories that's just related to me as well. So I remember there's a disease, a blood disorder, an inherited disorder called thalassemia. So I remember in Pakistan, the average lifespan of thalassemics were about 10, 12 years because of the inadequate sort of treatment facilities that were available here. And the problem was that it was only doctors running these centers and without the involvement of patients. So when I started my work on, working in patient advocacy area, I met other patients and everything. And I remember meeting this gentleman and his daughter at thalassemia, and he was so frustrated with everything. And then I said, yet I think you need to gather other families. You need to make a voice, and that voice needs to be heard. And that man, I remember, worked so hard. He collected other parents and other patients, and then they became an organization, and that organization started to work and do a lot of awareness and advocacy, and started pushing the governments and other healthcare authorities to provide more services for patients, not only for his own daughter, but for the community, thalassemic community. And over the years, he managed to get more and more and more services. And I must tell you, I think I'm talking about last 20 years, his services has really been rewarded. And now the average lifespan of these, thalassemic patients in Pakistan has increased tremendously. They are now doctors, they are now engineers, they are married, they are, they are, pursuing their businesses and in occupations and everything. So that's also a very motivating story for me, where one person started off and it literally changed the whole system and increased the average lifespan of patients. So a very, very motivating story for me.
Yeah, so you've been that one individual who's making this change for you and for everyone around. What would you like to tell your listeners in terms of your journey of being a change maker, change agent? You started with your personal story, and now you are enabling and empowering many others. Is there any key message or anything you'd like to say?
The most important thing is this: every patient advocate, every family member, every patient needs to take charge. You just don't need, be sitting around and, just thinking about, my life is over. No, you need to take charge. You need to have, partnership. You have to have a strong group together, and you need to work towards services, not only for yourself, but for the community. And I think when you're working for a bigger picture, for a bigger purpose, the God gives you a lot of reward. So that's what my experience is, and that's what my message is as well.
That's lovely, and it's great to have you, and we had a great conversation, Dr. Jafri. Thank you so much. And that concludes our today's episode of Speaking of Hope, Support and Heal. Thank you so much, Dr. Jafri.
Thank you very much.
So thanks to Dr. Hussain Jafri for sharing his extraordinary story and insights, helping and supporting many people around the world, being a change maker, addressing critical healthcare needs and closing gaps in healthcare access. If you found inspiration in today's episode, please consider sharing it with someone who might need a boost or a reminder that they are not alone in their journey. Together, we can spread hope and encouragement. Thank you for joining us here today. Until next time, take care, stay resilient, and cherish the moments that make life precious. Thank you.
Axios, transforming access to healthcare.